Welcome. I'm going to briefly review nutrition diagnosis statements, also known as PES statements. Developing these statements is an essential entry-level skill for a registered dietitian, nutritionist, or RDN. Recall that you can go back to your notes for nutrition assessment, NFS 3201. In addition, I've posted a sheet giving you a summary of the nutrition care process and the guidelines to use when developing nutrition diagnoses or PES statements. In addition to this resource, there are tutorials available that you can access in the online ENCPT. Let's first talk about the reference sheet. I'm going to briefly walk you through it. Step 1 in the nutrition care process is to perform a nutrition assessment. Remember, to do this, you have to decide which data to collect. You as the dietitian might have access to an electronic health record or electronic medical record, and you have to decide what to take from the history and physical, from an operation report, from certain testing that's been done, what labs to write down, whether you're going to perform anthropometric assessment or just rely on the weight and height that might be in the chart, which biochemical pieces of data you're going to rely on, and when you perform a nutrition-focused physical exam, what you're going to assess. Then you need to figure out what is relevant to this patient and what isn't, and what is valid versus what looks to be suspect. Next, you'll develop the nutrition diagnosis statement, also known as the PES statement. To do this, you first need to look at your assessment and kind of develop a list of potential problems. You might notice from the history and physical that the patient has both cardiovascular disease and diabetes. These are medical diagnoses, not nutrition diagnoses, but these medical diagnoses may affect nutrition status or nutrition may affect the disease, so it would be important to note these. You might also note particular nutrition problems that you identified during your exam, like low intake overall or low intake of a particular nutrient. Once you've looked at these problems, these overall problems, you're going to decide which problems are the most important from a nutrition perspective. It may be that you've really noticed that diabetes is a super important medical problem, but you're not going to identify diabetes as their nutrition problem. You might identify a problem with intake that relates to diabetes. You are going to consider domains when you develop this nutrition problem. So is it from the intake domain, the clinical, the behavioral or environmental domain? And then you're going to go to the online ENCPT, find the nutrition diagnostic terminology sheet, and you're going to actually choose the exact terminology to describe your nutrition problem. Then you're going to ask yourself, can the RDN actually affect this nutrition problem that you've chosen? That's an important part of it. And if there are several problems, if there's an intake problem that can be used. Next, you're going to look at etiology. This means you're actually going to decide what is the cause of the nutrition problem? What's the root cause? And you're going to ask yourself why once you define that etiology. So let's say, for example, you've chosen inadequate oral intake as your primary nutrition problem. This is the patient's biggest issue. And you decide that the etiology is lack of appetite. Well, then you'll ask yourself several times, thinking about root cause, why does the patient have low appetite? Is there an underlying physiologic cause? Is there an environmental cause? Is there a psychological cause? And you're going to drill down before you decide that lack of appetite is the best root cause for that problem. You'll also ask yourself, can the RDN actually address the etiology? And if so, will addressing the etiology either resolve the nutrition problem altogether or improve it? And if you can't address the etiology, you might not. If it's a physiological etiology, let's say their problem was swallowing is due to a stroke, then you at least want to be able to address the signs and symptoms. And then after you've determined that etiology, you're going to actually then go back and identify your signs and symptoms. Remember, this is essential. Signs and symptoms do not relate to the etiology. Signs and symptoms relate to the problem. They tell you that the problem exists and the extent of the problem. So if it's low intake, you need to provide signs and symptoms that demonstrate that there's low intake and how bad that low intake problem is. You also need to consider whether monitoring those signs and symptoms will actually show you whether the problem's resolved or not. And are those signs and symptoms specific enough that you can tell whether they're improving over time? Once you've done all this, go back and look at your statement one more time. Decide whether the nutrition assessment, the things you've written down as assessment, actually could lead someone else to the same nutrition diagnostic statement. Decide whether your problem is the most important, one or two. Is the etiology the root cause? Can the dietitian address the root cause? And if not, can the dietitian address the signs and symptoms, and do they relate to the problem? Next, you will go, I just want to point out that online you can find, in the ENCPT, you can actually find reference sheets for each nutrition problem, which I'll show you in a minute, that are an excellent place to go if you're considering a problem to find out a potential etiology and some signs and symptoms. I've also included some examples on this sheet of appropriate nutrition diagnostic statements. Almost finally, you choose an intervention. Your etiology should help inform your intervention. In other words, if you've chosen, let's say, an intake type diagnosis and your etiology relates to poor appetite, then you're going to want to have an intervention that addresses that appetite in some way. Your intervention involves both planning and implementation. So you have to plan with the patient how you're going to intervene. You have to go to resources like the Nutrition Care Manual or some a critical review of the literature to determine what the best intervention is for this particular problem. And then you're going to set goals together with the patient, set expected outcomes together with the patient, and you're going to communicate this plan both with the patient and maybe their family, and also with other members of the healthcare team. It's important when you're choosing an intervention that you do confer with other members of the healthcare team to make sure that what you're planning fits in with the rest of the medical plan. Remember that intervention may fall within food or nutrition delivery, and if you have chosen an intake type problem, you probably want to have an intervention that falls within the food and or nutrient delivery domain. You may provide some education, you might provide counseling, and you might provide coordination of care. You might do all of these, or you might do some of these. And also with intervention, you decide on a plan for monitoring and evaluation, and decide how soon you're going to follow up to find out if the patient's problem has improved. The last step in the nutrition care process is the actual follow-up, where we go back and monitor that patient hopefully on the prescribed schedule, and determine if their signs and symptoms have improved, where they are in terms of the expected outcome, if they aren't meeting their outcome, why not, whether their problem has been resolved, and maybe whether they have a new problem. I'm going to shift gears for a moment and direct you to the online ENCPT. Remember that the ENCPT actually is here to give you more resources. It's an excellent resource. There are under resources, there are tutorials. They're a little bit dry, but they're good. They have better video quality than mine. And in addition, you can go, once you're in the ENCPT, you can actually go to terminology, diagnosis, and then click there. And once you've done that, you can actually download all of this exact terminology. And remember, I said when you choose a nutrition diagnosis, you should be able to find the exact terminology on this sheet. Increased energy expenditure, inadequate oral intake. Let's go down to our malnutrition diagnoses if we can. Let's see. Yeah, under clinical, you could find chronic disease or condition related malnutrition, etc. So it's important that you use the exact terminology. Another thing that you can do from the ENCPT is you can actually go on the terminology to a particular diagnosis. Let's say you choose inadequate oral intake, and it defines what that means oral food beverage intake that's less than recommended standards. Etiology, maybe there's a physiological cause such as prolonged illness, decreased ability to consume enough, lack of access or limited access to food, maybe economic constraints, etc. And then it tells you some potential signs and symptoms. So if you're considering a nutrition diagnosis, this is a good place to go to find out if this is the right diagnosis and if you're using it correctly. You can go here to see if you're on the right track. And that is all we have to say about nutrition diagnosis today.